Braintree Rehabilitation Hospital, we're constantly looking at the literature and making decisions about what type of interventions to bring into our facility. A great deal of literature has been out on motor learning, and in particular, what components are required to maximize patient outcomes and patient function for people who've had neurologic injuries. And one of the newer technologies, or new technology, that has helped clinicians to exploit these concepts of motor learning or neuroplasticity has been robotic rehabilitation. So we really learned about robotics by looking at the literature and staying abreast of what's new in our field and understanding how to best respond and help people recover from neurologic injury. Once we decided and once we figured out that robotics were going to be something that was important for us to bring in, we were able to realize what the value added would be. We had to make that decision about which device should we bring in. So in this whole process, we really looked at it with two different perspectives, or two different lenses. The first lens, and the most important lens to us here at Braintree, was the clinical lens. Again, going back to what I just said, we needed to spend the time before we even decided on which device to understand the benefit and the value added that robotics would bring to our clinic. We were able to do that through the literature and the literature reviews. We also needed to make sure that we felt like the technology would be able to be integrated easily and seamlessly into our clinic. So we needed to spend a great deal of time with our clinicians at a grassroots level, making sure that they were fully on board with and had a full understanding and appreciation for how robotics would fit in, and hear from them how it would be integrated to make sure that it was something that we would be able to truly do and be beneficial for us. We needed to know that robotics wouldn't be a program in itself, but instead robotics would be an enhancement to our already existing programs in neurorehabilitation, such as brain injury and stroke and multiple sclerosis and spinal cord injury. Then we needed to move into the second lens, or the second perspective, in order to bring the technology into our facility. And that would be the business model, or the business perspective. We needed to justify to ourselves as a clinical leadership team and to the administration for approval for capital outlay that there would be a return on investment, that the purchase of the modality would not only benefit our patients clinically, but it would help our facility from a business standpoint. And so we were able to use a return on investment model. We did base the majority of that model on volume. Would a modality like this, an intervention or a tool for our therapists like INMOTION robotics, be able to help us to attract a patient population that we haven't had before, or would there be a reason or a differentiating factor that would have people that had neurologic injuries to decide to come to Braintree? And that was really the key, is that we have a population in the United States of people who have experienced a stroke greater than a year ago, and they may have had a stroke even up to 5 to 10 to 15 years ago. And back 10, 15 years ago, we said very different things about the recovery in the world of rehabilitation. There was a process that said, well, after 6 months or after 1 year, that you would plateau, and that was the motor recovery and the functional recovery that you would anticipate, and that's what you would have for life. And we know that's not the case anymore. We know that certainly after the first 3 to 6 months, recovery will often slow down in the sense of the rate of recovery, but that it doesn't stop. That there are different components of interventions that we could put in place that will allow people to continue to recover even lifelong. And that there is a reorganization of the central nervous system. And this reorganization, often we refer to it as neuroplasticity, will allow patients to continue to recover, albeit slowly, but continue to recover. And again, we've proven that that robotics will help with that, will help therapists. They can use the robotics as a tool to really exploit these components of motor learning that we so much know exists in the industry or in neurorehabilitation. With that being said, we were able to make justifications from a return on investment model, and once both perspectives were satisfied, it was really very clear to us that this was going to be a modality or an intervention that we wanted to add here, and that we were able to add here. And we were able to use that as rationale for administrative approval for the capital outlay.